So, today we're going to talk about pain on the tip of your shoulder, right? So, before we go into the topic, let me just introduce myself. For those who don't know me, my name is Swati. I'm a physiotherapist, and I do these videos just because I want to bring about patient awareness. Patients awareness, and I want people to know about what's happening when they have a shoulder pain. Is it a frozen shoulder? Is it impingement? Is it dislocation? Is it just a pain on the tip of the shoulder from a joint known as acromioclavicular joint? So, if you like what I'm talking about at the end of the video, go to my YouTube and give me a subscribe and press that bell icon if you want to know about any of my live videos in the future. All right. And yeah, if you're watching me on the replay, please comment hashtag replay so I know you've been here. If you're watching me right now, just say hello so I know you're here. And of course, if you have any questions, feel free to ask them anytime, now or later. All right, so today we are going to talk about this joint which is on the tip of your shoulder. I have many patients who come to me for shoulder problems. The problem resolves, however, the tip of the shoulder pain takes a long time to go away. Now, patients are wondering what has happened. Why is my shoulder pain not resolving, right? So, we need to educate our patients, and that's exactly what I thought I'll discuss with you here today. So if you trace your collarbone, so here's your collarbone, if you trace it all the way up to the tip of your shoulder, and there, if you look at your shoulder blade, there is like a long bone that juts out. It's okay if you can't trace it, you just trace your collarbone all the way up to the tip. This is a joint known as a acromioclavicular, or in short form, we call it a AC joint. Okay, so basically, this is a joint which is surrounded by a capsule, and the bones that are together, like the one that is coming from behind from your shoulder blade, and the one that is coming from ahead, which is your collarbone here. So, these two, where they meet, the bones have a cartilage over them, similar to your knee joint, right? So, in your knee joint, you have this cartilage which is at either ends of your bones, so the long bone of your leg and the thigh where they meet, there is a cartilage on either end and there's a capsule that surrounds the joint, right? Similarly, this tiny joint here also has the same sort of a structure. Okay, so I'll explain you later why this is necessary. So that's why I'm going into the anatomy. So, yeah, and there are quite a few ligaments in this area, right? Because if you remember our videos that we've done, now we're doing a shoulder series, right? So if you remember the video we had done on the frozen shoulder, I was talking about the anatomy of the shoulder, and you'd realize that there are lots of ligaments in this area. So similarly, there are quite a few ligaments that stabilize these AC joints as well. So there are four main ligaments. So one is like they basically all of them are running. You don't need to get into the major anatomy of it, but all of them are running in between your shoulder blade and the collarbone here. So these are the four ligaments, and then the injuries of this joint are also classified according to how much damage is present in the joint, right? So, for example, if your doctor tells you you've got a grade 1 AC joint injury, you'll be like, what? So they are classified as per grade 1 till grade 6. So grade 1 is when you just have a little strain on that joint, the ligaments are all intact, all you have is a strain in the joint, right? So that's like the lowest and easiest that you can get away with. Then as you go further, say you have one ligament that is torn out of the four, then you that is grade 2. Grade 3, you will probably have two sets of ligaments that are torn, and grade 3 onwards the bones will also be displaced. So these two bones that are forming the joint, either they'll be displaced up, behind, or below. So that is superiorly, posteriorly, or inferiorly, right? So that is basically, as you go up the grades from 1 to 6, the amount of structures involved will increase. Okay, so next time your doctor, hopefully never happens, but next time your doctor mentions you have like a grade 1 or a grade 3, you would know it is Grade 1 is less, and grade 3 is more injury in that area. So, how does this injury actually happen? Sorry, I'm looking at my notes here just to make sure I'm not missing out anything. So, I've got them right here. So, the injury can be either a person falls down and lands on the tip of their shoulder, or you have an injury in which something comes and hits you on the tip of your shoulder. Okay, so for example, if you're a cyclist, you are into skiing, or you're a hockey player, and something comes and hits you, or you're a cyclist, you're a hockey player, somebody's hockey stick comes and hits you, right? That will be painful. So that can hit your AC joint, right, if it hits the point of your shoulder. Or you're a cyclist or skier and you fall down, or contact sports where something or somebody comes and hits you on the shoulder, right? So, or if you are, say, a worker, you're not an athlete or anybody, but you are not in the sports, but you are, say, on a ladder, you're climbing up there, and you fall down, you fall on the point of your shoulder, right? Or I mean, you fall in a sideways position. So these are the types of injury situations where you can have a AC joint injury, right? And usually it's seen more in males and mostly after 35. But it does not mean to say that younger population is not affected, right? So yeah, so you can have usually around 35 plus will be affected, but you can have younger people getting affected as well. Okay, another thing that happens is, apart from falling on the shoulder or something coming and hitting you on the shoulder, do you remember when I was talking about the cartilage on the joint, and then there's a joint capsule? So whenever there's a cartilage and two bones are like meeting each other, there is chances of arthritic changes. So if you have a job where you do a lot of overhead activities like lifting and carrying something, putting it up there, so what can happen is, over a period of years and years, or if you are a heavy weight lifter, say you are a trainer and you do a lot of heavy lifting and you're going every day, you're training your clients, or you're into heavy lifting and you do that every day, you can have arthritic degenerative changes in the joint. So that is when you can also get the pain in the tip of the shoulder. Okay, so what are the symptoms? So obviously you'll have tenderness, you'll have pain, you might have a swelling. Swelling will be more around the acute or subacute phase. Or if you have a chronic problem, you can have lack of strength in the shoulder, the range of shoulder movements. If you remember, we talked about the shoulder movements in my previous video. If you haven't seen the videos, please do go ahead. There's a shoulder series in here and you can look at it there. So you can have a lack of range in any of the shoulder movements. Usually the movement that is affected is, if I tell you to go across and, say, touch the shoulder blade on the opposite side, or just the shoulder tip here. So anything that goes like horizontal movement across like this will give you that pinching effect in the AC joint and will give you the pain in the AC joint, right? So again, looking at my notes, is there anything? Oh yeah, sometimes when it's a fresh injury, there can be bruising as well. And when you lie down on that side, it can be quite painful. So in the night, unknowingly or knowingly, if you turn over to your shoulder on the affected side, you will have a lot of pain. Now, how do doctors diagnose this problem? They will obviously listen to your symptoms and they will have a feel around your shoulder. They will send you for an x-ray. Most of the times, apart from stage 1 of the injury, most of the times what happens is there is a marked step deformity, is what we call it. So basically there is like a visible bone protruding out. So, like a bump on the shoulder tip here, right? So, that is called a step deformity, but that happens when your ligaments are broken. So, it's only stage grade 2 onwards. So, if the ligament is broken and the bone is sort of protruding out of its place, there's nothing holding it there, then you will have that little bump over the shoulder, right? So your doctor will look at that and they will look at your x-rays, they will compare it to the normal non-affected side, and then they will tell you you have a problem in your AC joint. um, Usually if you go to a physio, we have some tests that we do. So basically, apart from moving your shoulder around, seeing how much strength and movement you have in your shoulder, a physio will also do a few tests of your shoulder to rule out other pathologies of the shoulder like instability, etc., etc. and they will do a test specific for AC joint, and they'll tell you, okay, you've got a problem with the AC joint. So now what? If you have a problem with the AC joint, how a physio can help you is they'll help you to identify the triggers that lead to that AC joint problem, right? So it can be variable. As we saw, the mechanism of injury can be variable, the triggers can be variable. So maybe you're doing something like, for example, again, the overhead activity, maybe that's something you're doing every day, and it is triggering off that pain in that AC joint. Now that's something you can easily control, right? So a physio will help you identify those triggers. And yeah, and pain management at home, you can do either hot or cold pack. We've done videos on hot and cold pack before, so you can have a look at those. And the same principle applies to all the joints in the body, so you can do those. And physiotherapist will help you with pain management. If you have any muscle imbalances or any lack of strength, it can help you with the exercises without hurting your AC joint, right? So now you want to do exercises, you want to strengthen, but you do not want that joint to be hurt. All right. Now, another thing is that if you don't maintain your range of motion, so suppose I have this AC joint problem, and yeah, one more thing that happens is usually when you're taking your arm up, so usually up around 90-degree onwards, you will hear a click or a pop in your shoulder. So most of the times, patients are too scared to move the shoulder around completely. They can get into a frozen shoulder problem then. So you see, you've got your AC joint leading to your frozen shoulder then you have more problem, right? So better to fix it before. All right. And yeah, another thing we do is functional training for the patients. Now suppose somebody is into sports, they have a AC joint problem. You cannot tell them don't return to sports. So a physiotherapist will help you rehabilitate, so that even if it's a long-term goal and it takes you a while to get there, a physiotherapist will help you to get back into your sports slowly and gradually over a period of time. Okay. And even if you're not into sports, any daily activities that are causing more pain will have to be avoided initially. But like, for example, if I like to tie my hair up, right? I'm going with overhead activities because that's most commonly affected. If I have a problem tying my hair up, right? It's not that I'm going to leave them down forever. You have to get into those activities. So once you have that strength and the ability to do it, how do you gradually transition into it? This is a very simple example, but obviously there can be many, many activities that are restricted. So this is how a physiotherapist can help you. So, okay, so I guess that was it that I wanted to cover with the AC joint. Again, referring to my notes here. And yeah, that was it really. If you have any pain or discomfort in your shoulder, feel free to contact me. I'd be happy to help you. And if you like what I'm talking about, feel free to join my free Facebook group. For those who are watching me on Instagram, it's on my bio. It says my community. And for those of you who are watching me elsewhere, I'll leave a link in the comments, in the description. Sorry, I'll leave a link in the description or the comments. And yeah, feel free to join me there. I'd be happy to help you. Okay. Bye for